We are ready. Good morning, everybody. How are you? This is Jevon Thomas with Crystal Mitchell. We are talking on the show Conversations on the Patio, and we have a special guest today, Jane Reese Wilkins. How are you, Jane?
I'm fine.
Great. And how are you, Crystal?
I am fantastic. Another Monday. We'll see how fast this week zips by.
Well, as always, I am so glad that you're here. I'm just excited that Jane is with us. We're going to talk about Medicare. That is awesome. So many people have so many questions, and Jane just filled me in on how she, and I want to steal this, takes the sting out of choosing Medicare plans. I think that's a great analogy. We can talk about that. Before we get started, I'm going to read Crystal's bio, and I believe Crystal has Jane's bio.
Right.
Mm-hmm. Okay, so let's jump right in because I know I have a lot of questions. So here we go. Mm-hmm. Welcome, Crystal Mitchell. Crystal is a business coach and consultant. She's the CEO of Mitchell Business Solutions, co-director of Recycling Black Dollars, co-host of the Business Zone with Crystal and Gilbert, and other weekly radio show. Instructor at Mount San Antonio Community College, a certified network for teaching entrepreneurship instructor, and a QuickBooks Pro Advisor financial strategist. Thanks for being here, Crystal. And let's hear about Jane.
All righty. Thank you, guys. Glad to be here another week and another wonderful conversation. So we are honored to have as a guest today, Miss Jane Reese Wilkins. She's a resident of Pasadena, California. She's the proud mother of a 19-year-old daughter, Michael, who attends University of Oregon and who also was a member of the 2020 Royal Court in Pasadena. So you guys probably all remember that. In 2020, Jane transitioned to the insurance business after the real estate market became uncertain, and she worked for New York Life from 2007 to 2010. After that, she became a financial services professional specializing in long-term care. Jane's company, Jane Reese Wilkins and Associate, has served the residents and businesses of Southern California since 2007, offering the best insurance programs to fit your needs and your budget. The company's mission is to work with individuals, families, and businesses to ensure they get the right information to make the educated decisions. And she specializes in Medicare benefits. She's a Medicare benefits consultant, and she offers Medicare advanced plans and Medicare supplement plans. And she also does enrollments for Covered California and has enrolled over 700 people since its inception. And they also offer employer group plans. So we are so happy to have you, and welcome to Community Conversations on the Patio.
Thank you.
Thank you. Right. So other than that fantastic bio, tell us a little bit more about yourself, personalize that, and then we'll go into asking questions and things that you feel is important to our to the audience.
You pretty much said it all in the bio. I'm just very busy with my business, and I do have a daughter, and I enjoy doing what I do with Medicare because there's so many people that don't understand it. So I really feel like I'm helping people. So I definitely feel like I'm helping people. So I work with doctors. I have a lot of doctor clients, and I take care of their Medicare population. I work with senior centers, some senior apartments. And so I stay busy.
I bet you do.
Yeah.
And you said something while we were talking before the show, and that was that you get paid by the plan. So people shouldn't be intimidated about giving you a call because this planning of what's appropriate for them for Medicare is not going to be charged to them. Is that correct?
Right. So what I do, I'm a consultant. And so how it works is this. When people call me and they say, I'm getting ready to turn 65, I give them their options. Okay. And so what happens is I'm certified with 14 Medicare Advantage plans, and I also do sub plans. So there's some people that like the Medicare Advantage plans because they're HMO plans. and they don't mind having a primary care doctor and being affiliated with a medical group like Optum, and their doctor has to give them a referral to their specialist. But there's some people that say, I don't want a Medicare Advantage plan. I want a plan that works like a PPO because I don't want to have to go through all that red tape and get a referral. So then they get a Medicare supplemental plan, which works more like a PPO plan. Then you can go to any doctor you want. You don't have to ask for a referral. The only difference is that for the Medicare HMO plan, there is no cost for most of those plans in Los Angeles County. You only have to pay for the cost of the Medicare Part B. But for the PPO plan, the MedSup plan, there is a cost to that. So the nice part about me, I'm certified with all the plans, so I'm not biased. So what I'm going to do is find out what your need is and what's important to you.
Okay. One of the questions I have, and I'll let you jump in, Crystal. You know me, I'll talk all hour. But one of the questions I have is, do you have to go into Medicare? Do you have an option if you're comfortable with your own insurance, let's say?
Okay. So what happens is if you turn 65 and you qualify for Medicare, okay, you can get a plan for Medicare. If you say, I'm 65 years old, but I want to keep working. I don't want to retire. So, there's a lot of people that are working up to 68, 70 years old these days because they don't have enough money for retirement. So they keep working and, or they just like to work. So if you have an employer plan, you can stay on that employer plan. You do not have to access your Medicare at that time. So I have people that come to me and say, I just turned 69. I did qualify for Medicare at 65, but I wanted to keep my employer plan, but now I'm getting ready to retire. So at that point, then they access their Part B for Medicare, and then I put them in a plan. But what they have to show that during the time that they qualified for Medicare, that they had credible coverage. Because if you don't show that, they're going to penalize you.
Okay.
They're going to penalize you. So yes, once you turn 65 and you can get your Medicare, if you don't have credible coverage, then you will get penalized. So
now, what is credible coverage? What does that mean?
Credible coverage is considered like an employer plan. I don't think it would be like a Covered California plan. I don't think that works, but it would be an employer plan. And so what happens is usually after I enroll somebody, after they've been working all those years and they didn't stop and get their Medicare, once they enroll in a plan, then they're going to get a form that's going to say you need to prove to us that you had an employer plan. And that's credible coverage.
I see.
Now, what's the difference? So let's say I've been working for a company and obviously I've been paying into Medicare and Social Security and so forth. And that's a no-brainer for me, right? So when I turn 65, it's easy to prove if my employer provided insurance. But what happens with the entrepreneur type person that is hopefully they're paying into their self-employment tax so that they can make sure that have Medicare? What happens to them when they
I believe you need to get a plan. You need to get a Medicare plan.
A Medicare plan.
Yeah.
So they can just go ahead and apply.
Yeah, they can go ahead and apply.
Okay.
Yeah, so you can get a Medicare plan. And then what happens is a lot of times people will call me and say, you know what, I do have the option of going to Medicare or staying with my employer plan because I'm still going to work. But so what I tell them is that compare the plans. Just compare it. Okay. So with Medicare, I believe the Part B premium is $148 right now. So if you're going to get a Medicare HMO plan, all you're going to be paying is $148 a month, because you're only paying for just the cost of the Medicare, because the plan is free. Okay. But with the Medicare Advantage plan, you get all these benefits. You get dental, you get transportation, you get a prescription drug plan, you get chiropractor services, acupuncture services. All these services are free. Okay. They even give you meals for after surgery. They deliver meals to your home. And then there's even a benefit called over-the-counter drugs, where there's some plans that give you $500 a year. And that means basically anything you can walk into CVS and buy over the counter. So that's cold medicine, that's vitamins, a wristband, peroxide, cotton, and that saves a lot of money. So then you can weigh that out with the employer plan and say, okay, I may only be paying $100 for that plan, but look at all I get for the Medicare, and I'm only going to be paying $148. So I tell them to weigh it out.
Yeah. Now, Crystal, do you often run into entrepreneurs that have maybe a couple of employees to where the employee would say, if I go on to the Medicare plan, then my employer doesn't have that fee for health insurance. And so thereby saving the employer some money, because they're employing someone who's actually getting their health coverage paid by Medicare. Do you have that situation?
Every now and then, yeah, because for small businesses, micro businesses owners, health insurance is a pretty expensive task for them, right? They're doing well just paying an employee and their share of their payroll taxes. So if you have an employee that is older and has Medicare or can apply for Medicare, yeah, that's a benefit to them. That they don't have that. But I'm going to also say, I remember when my mom was ill with, she had her employer plan after she retired. She had her employer plan, right? And then when she got sick, it was such a challenge getting things approved that we could get her help to, make sure she got all that she needed while she was in treatment. That her a physician who was elder care specialist, that was her what did you call it, geriatric, that was her specialty. So she told me to have you switch your mother's plan over to Medicare. So much easier for us to do what I need to do for her, then you have to go through these process to wait for her medication to be approved. And once I did that, it was so simple after that. It made that switching. Wow. But sometimes with them, they're like, oh, this is my health insurance, and I'm not. It took some finagling to get her off of her employer. She purchased that plan over to Medicare. I don't know maybe it was a stigma. Same thing with my uncle. I never could get him switched over. Thank God he had the VA.
You want to know? Oh, and let me say this. VA, when you are in the military or when you've been in the military and you have a VA plan, they let you have both.
Oh, really?
Yes. And that is because you serve the country, where most people can't have an employer plan and a Medicare plan. But if you're a veteran, you can have the VA and Medicare. And a lot of them don't know that because they already have the Medicare card, and a lot of them are paying for it, but they don't even know that they can get the plan. So they get to have both.
That's amazing. My dad is a veteran. I don't know if he knows it. I think he goes to the VA. I don't think he knows he's eligible for Medicare as well. Right. In fact, I remember talking with him and him saying that he had to choose which one, and he didn't want to give up those VA benefits.
No, he can. You know what? There is a program with the VA, and it's called TRICARE. And I think that's a different plan than a lot of VA plans. I don't touch that because that's a great plan. And that's what happens with me. It's like when someone comes along, like that works for the post office, or they have a TRICARE plan with the, With the
Government.
VA, I do not touch that. I don't want to mess up anybody's insurance. But Crystal, I did want to go back to you back and talk about how when you were saying how your uncle wanted to stay on his plan, your mother wanted to stay on her plan. And so a lot of times seniors especially, they don't like change. Okay.
Yeah.
And what happens is, this is what I tell them. So say for instance, Optum is a medical group. Have you ever heard of Optum? It's former healthcare partners. So most doctors who are internal medicine doctors, they're contracted with a medical group of some, or sometimes one, sometimes 5, sometimes 10. Okay. So if your Dr. Jones, if he's contracted with Optum Medical Group, Optum has 18 Medicare Advantage plans.
Really?
So that means your mother or your uncle, they can change their plan, but they're still going to see the same doctor. Their doctor takes the same plan because that doctor is contracted with Optum. So that doctor is contracted with all the plans that Optum's with. And so right now, we're in open enrollment right now, right? So that started October 15th. It goes through December 7th. And what that is for, if you're on a Medicare Advantage plan, but let's say you're not getting your needs met. So let's say you need dental, like you need more dental. And let's say plan A that you're on doesn't really have a lot of dental, then you could call me and say, Jane, we're in open enrollment right now. What can I do to get a better dental plan? I'm going to research a plan that gives you better dental. Then we can switch the plan. And so that's what happens, what's ever going on with you at the time. I had another client call me yesterday and she said, I need a plan that has more transportation. My daughter can't take me to the doctor anymore. So I'm moving her to another plan. But the thing is, her doctor takes all these plans. So the plans basically have the same thing, but some plans have more bells and whistles than other plans. So just so you know, anybody that has Medi-Cal, they can change their plan every quarter.
Oh, I didn't know that.
So you don't have to wait till open enrollment. There's different reasons why you can change your plan. So a special enrollment would be someone that is on Medi-Cal. They can change every 3 months. Okay. It used to be every month, but they changed that in 2019, I believe. Or if you just move to the state of California, they open up a special enrollment. Or if you move out of if you move from Los Angeles to Palm Springs, then you're out of your plan service area. So you have to change your plan. Okay. But if you develop a chronic illness, you can also change your plan. So if I put you in a plan when you first turn 65 or it's open enrollment, you can call me and you could say, Jane, I have diabetes now. That gives you a special enrollment to move to a plan that works better with people who are who have diabetes. Or if you tell me that you have heart disease, or if now you're on dialysis, now you have to move to a plan that covers that. So there's different reasons why they will let you enroll into a new plan during for a special enrollment outside of open enrollment.
So that doesn't, no pre-existing conditions and things like that that limit any bit.
Pre-existing conditions, you can have cancer and get on a Medicare Advantage plan, okay? But that applies to, if you're on a Medicare supplement plan, when you first enroll, when you're 65, it's a guaranteed issue. But if you're on a Medicare supplement plan, and they call that MedSup, Medigap, those are different nicknames for it. And you don't, and you enroll in that when you're 65, it's a guaranteed issue. But if you on a Medicare Advantage plan and you want to move to a MedSup plan, you do have to fill out a statement of health. But if you're on a Medicare Advantage plan and you want to move to another Medicare Advantage plan, you could have cancer and move.
Wow.
Okay. That's great. So I deal with a lot of people who are hoping to become entrepreneurs and who are, helping their parents deal with Medicare. So what's the best thing for a person who is in their 30s or whose parents are approaching that age? What's the best thing for them to do for their parents with regard to Medicare?
Call me and I can give them direction.
Yeah.
Because that's really, well, I'm going to tell you the first thing, a lot of times I get calls from younger people that have their parents in a senior living facility.
Mm-hmm.
And they're overwhelmed because they're helping to pay for it, or they're trying to hide their parents' assets because they don't want them to come back and take the house. The first thing that I always tell them, and we end up talking about it eventually, they need to get long-term care plans, because a lot of people that see their parents going through that, they're thinking, oh my God, this is so much money. This is overwhelming, when they could have gotten a long-term care plan, and then it would have covered the expenses, where people are thinking, oh, it's too much for a long-term care plan. I go, no, what's too much is $5,000 to $7,000 or $8,000 once your parents are in a long-term care situation. That's what's too much. But I don't want to get off track. But what happens is when people call me and say, I'm getting ready to turn 65, or my parents are getting ready to turn 65. And usually, unless your parents are incapacitated and you're the power of attorney, then you can call me, and then I'm going to direct you to the Social Security office to access your Part B, and then I assist you with the plan. Does that make sense?
Yes.
And just so you know, every year I get certified in all those plans again, because each year, like the upcoming year for 2022, I have to know all the benefits and all the plans. So every year I have to take a test in all those plans. And so when I'm taking that test, I'm looking for all the bells and whistles. I'm thinking, oh yeah, I'm going to choose this plans for my people that are just straight Medicare. I'm going to use this plan for people that are Medi. I get excited about how I can help people. Okay.
Wow.
So I have to get recertified every year.
Wow. That's great. So
Yeah,
you are a source or a catch-all for all kinds of interesting situations. Can you tell us the strangest situation that you've ever come across?
Oh, there's been so many of them. There, as far as what, just people that need, well, you know what? I'll say this. There was a guy that I just helped, and he called me back in April, and he said, I went to the doctor and I had to pay for all my drugs. And I said, well, what kind of plan do you have? He said, I have a Medicare plan. I said, what plan is that? I said, what kind of plan do you have? Is it Scan, Humana? He said, no. He said, I have the red, white, and blue card. I said, that's not a plan. That's just Medicare. That just covers you just 80%. The plan gives you 20% coverage, and then that covers you 100%. So he didn't even know that he needed a plan. So a lot of people, they don't even know that, when I turn 65, I get my card, then I have to enroll in a plan. There's some people that think that red, white, and blue card covers you, will just take care of everything. So this poor man was paying $300 to $400 for his drugs every month. But then what happened was he did not enroll when he was supposed to enroll, and he was locked out. So he had to wait all year until open enrollment. And so now I'm able to put him in a plan that covers his drugs. So a lot of this is just getting the word out, and just because a lot of people simply don't know what to do.
So if you're turning 65, say in 2022, whatever, January through for the whole year,
Right.
what should you be doing at this point?
Okay, so you have a 7-month window. Okay, so if you're turning 65 in January, you have 3 months before your birthday and 3 months after your birthday to enroll in a plan. So that would mean you need to enroll in December. Okay, so that means you probably should call me in November and we could start the process. Okay, so you have a 7-month window, and if you don't enroll during that time, you're locked out until October
Of the next
year.
During open enrollment,
During
you
open
can
enrollment.
Yes.
Okay.
Yeah.
And that's, of course, if you don't leave the area, or if you're, or you mentioned another reason why someone might need to enroll in the plan. Did you say they're quarterly, or I guess I got that part mixed up?
If you have Medicare and Medi-Cal, you can enroll every 3 months. Okay.
If you already
have Medicare only, you can only enroll during open enrollment. You can change your plan. Unless you develop a chronic illness or something like that, and then they allow you to enroll in a plan during outside of open enrollment.
And Medicare obviously covers you. Doesn't matter what state you're in, as long as you're in the United States.
Yeah, you know what happens is if you go on a trip and you get sick, as long as you go through the emergency room, they will cover you. My mom was visiting her sister, and she had to have emergency surgery, and she ended up staying for almost 3 months, and everything was totally covered.
Oh, wow.
Everything was totally covered. So as long as you go through the emergency room, you're good.
Okay. Go ahead, Jevon. No, go ahead.
I have some friends that are doctors, and they have issues with the amount of payment they get from Medicare. So they don't like to, many doctors don't like to, work with Medicare. Is there something that the Medicare participant can do to ease that burden, or?
Well, you know what? It depends on, so doctors, the doctors that are contracted with medical groups, like a group called Optum, when they get with them and they first get contracted with them, I think they negotiate a capitated rate. They negotiate a rate with them. And so what happens with the doctors is that no matter how many times that patient comes in every month, they just get paid once a month. But then they also get paid if that patient doesn't come there. So every month that doctor is getting a fee for that patient, regardless or not if they go to the doctor. So there's some doctors, because I have about 10 doctors who I call on. Okay. Some doctors see how they can make the money off of that. They do. Because what happens is, if you have a bunch of clients that come in once a year, you're getting paid regardless if they come in or not. Right?
Okay. Sure.
So there's some doctors that have kind of figured out how to make money with that. And those are usually the younger doctors, I find out. Those are the younger ones. The older doctors are used to fee for service, and they like the fact that they can bill every time that client comes in. But that is kind of, it's kind of leaning toward HMO now. So that's really, and so it was really a push for that a couple of years ago into HMO. So a lot of doctors got out of private practice and they went to work for Kaiser, or they just retired. But a lot of things are leaning toward HMO, and I think that some doctors they've figured out a way to make money with that.
Wow.
I don't know if that helps, but
yeah.
Well, that does, because sometimes that's what you have, and I've heard, I know when we were looking for hospitals and stuff, especially when usually, when you turn 65, all kinds of ailments just come running at you. Seems like the minute you turn 65, and so you're dealing with this onslaught of new ailments, and then trying to figure out your health insurance component of it. And then you like, this doctor doesn't take it, this doctor doesn't take it, but I need to get in there. So it becomes very confusing.
But you know what I do though, when people first call me, the first thing I do, I tell them, okay, the first thing you need to do is call the Social Security office. Right now, I think they're closed because of COVID, or you could do an application online, or you can make an appointment to do it over the phone. Okay. Then what happens is, after you get your number and your card, you come to me. At that point, I get all the medications that they're on, and I have them send me all their doctors. Okay. So what I do is research a plan for them. And then when you call me back and you have your Part B together, I'm going to say, here's this plan. I know all your doctors take it, and it covers all your medications. So I do that homework for you. And that is where I come in, because yes, you're going to have people calling you, brokers, you're going to be getting inundated with mail. And so what I do, that's how I take the sting out of it. I take that all away from them, and then I handle everything, because I've been doing this for 8 years. I've been doing, Medicare. I understand the whole process, so they don't have to deal with all that. Because it gets
you are awesome. I wish I had known about you.
Yeah, because that's what I do. I take that all off your hands.
And you're paid by the plan. So the person, they should call you. There's no reason for them not to call you.
And they do call me. And then what I do, I navigate with you through your Medicare years. If you get a letter you don't understand, if you're not happy with your doctor, you can change your doctor every month.
Really?
Yeah, you can change your group every month. If you're not happy with Optum, you can go to Regal. So you can change your doctor and your group every month.
Wow, these are the things that one does not know. And again,
so it's no need to freak out. There's no you just call a person like me. And yeah.
Just call.
Who knew
We're definitely going to get that phone number. Definitely going to get that phone number. We need to pass that along. That's a great number for folks to have. Great.
Right.
Wow. Jevon, we on the conversations on the patio, that's what we're talking about. So usually with Jevon, he plan, right? So we suggest start planning in five years before it's time for retirement. But you should be incorporated in that team at least in the 3rd year before you're about to go. So then a person would have a clearer idea, because it's so much when you start to retire and have to make all these great decisions. How much does it cost for the Medicare Advantage for you plan? Is that
the Medicare Advantage plan? Remember, I said it's free in most counties in Los Angeles. It's free in most counties. Los Angeles is the best place to be for health insurance. Okay, if you go up to San Francisco, you go to up north, or if you even go to, I think it's Orange County, they have premiums, but most of those plans in Los Angeles do not have a premium. There's no premium. You're just paying for the Part B.
The Part B.
And people get confused because they think, they're paying for the health plan. No, there is no cost. There's no monthly premium for the HMOs. It is for the Med Sup plan.
I see.
Yeah.
So can you work in other states, right? So can other people?
You know what? I'm contracted in Maryland. I was contracted in Nevada. I'm going to get contracted in there again. I'm going to get that license, but I do plan to become licensed in I think in Oregon, because my daughter's in college there, and in DC. So, other places. Yeah.
Okay. All right.
Now, how does the Medicare work with covered California?
Has nothing to do with the other.
So they're two separate entities.
Totally two separate things.
Okay. So if you were on a covered California 65, then you actually switch. You now are 65.
Yeah, you cannot be on covered California at 65. As soon as you turn 65, they kick you out.
Oh, wow.
Oh yeah.
So all of our folks on covered California, they need to be talking to you.
Yeah. As soon as you get to be 65, you're done.
Oh, wow.
Oh, really? Okay. So age 65 is the cutoff, and then you need to be reaching out and getting prepared for your 64 Medicare.
Right. Yeah.
Awesome. Yeah. Wow. This has been very informative.
It really has, and I think as people get older and are deciding that they're going to continue to work until 70, I mean, so many of us are, well, I'm not, of course, but we have that time where the Social Security Administration says you don't start getting your checks until 67, or for some people 70, I would imagine. So folks are kind of planning on working longer than they used to, right? So I would imagine that those conversations about Medicare and still being employed, for example, entrepreneurs, they're still employed, but picking up that healthcare insurance when you need another employee, that could be expensive. Am I on track here? So encourage your employees
insurance. If you God, let's say if you're 64 years old or 63 and you don't have any Medicare, and if you're on the PPO plan, you're gonna be paying like $1,700 a month. It's like apartment rent. It's insane how much insurance is.
Right.
If you were to go buy a plan on your own, but no, entrepreneurs, the important thing is that they have to make sure that they're filing taxes and paying into their Medicare. Because I know people that have been entrepreneurs all their life and never filed taxes.
Yeah, that's true, because they don't have to.
And now they can't get their Medicare because they did not pay into the system.
Yeah. For Social Security, it's 40 weeks. What is it for Medicare?
It's 40 quarters. It's
40 quarters. I'm sorry, 40 quarters.
Years.
10 years, yeah. 40 quarters. Same with Social Security. Yeah.
But let's say you were a housewife, just for example, and you didn't work, but if your husband worked, then you get it under him.
Okay.
That's
good to know.
Yeah.
That's very good to know.
And the same if they divorced.
You know what? I would I think it would depend on how long they were married.
Okay.
Yeah.
Interesting.
Yeah.
Wow. This is really interesting, again, because the Medicare piece is always, even when you have a parent, elderly parent, even during that time when I was going through all that, it was very confusing on what to do and how to move it. And like my uncle, he was with SCAN, and there was a whole lot of limitations when he was diagnosed with prostate cancer, and he had to go through treatment. So we switched him over at that time to the VA because the treatment was, didn't cost him anything, and he was a veteran, and so the process was so much easier, longer waits and so forth. But the frustration of trying to get him the care that he needed was just outrageous.
Well, there's some, that's why there's some people that like Med-Sup plans. So a lot of my clients that earn more money, they will just straight out say to me, I don't want a Medicare Advantage. I want to med sup. I do not want to deal with that red tape. I want to go wherever I want to go to. I make a good retirement. I want the med sup. Okay. So I give them what they want, you know? And then there's some people that say, I don't mind my Advantage plan. I have a doctor I've been going to for years, and the specialists are all in the group, and we haven't had a problem. Even though I make a great retirement, I'm just going to go ahead and just stay with the Medicare Advantage. So it just depends on you and what you want to do.
I'm loving this conversation, partly because now I'm thinking about the people who listen to our conversations, the ones that Crystal and I have, and this terminology is really interesting. I have no idea what it means. So you've got Medicare Sup, Medicare Advantage,
and Medicare Advantage. It's really kind of easy, Jevon, because the Medicare Advantage is an HMO, okay, and then the Med Sup. It's not a PPO, but it works like a PPO because you can go to any doctor you want to go to.
Okay.
Right. You don't have to get a referral.
Right.
You don't want to ask. You don't want to have to get a referral. So that, it's just a preference. It's just up to you.
Well, I'm glad there's folks like you that can help people go through that, because I'm sure when I get to be 65, things are going to change, but I'm certainly not going to be the kind of person that wants to get a book and read through that and figure out, oh, this is going to be right for me. So I'm glad you exist. Just stay around for the next 10 to 20 years.
Thank you. I'll be in this for a while. I love what I do.
That's great. That's awesome.
I didn't know there was a person that was, like her, that was more
what's really weird is like, you hear about people that are, they do life insurance, they do what Jevon does. I mean, they do retirement, or they do financial planning and stuff, but you really don't hear that much about Medicare consultants. You really don't. And I noticed that because when I got into it, I was like, well, I never heard of this. I never really heard of it. So I don't know why that. And it's really interesting because there's not a lot of African Americans that are in this business. And I noticed that. I noticed that we are not in this business. So I love that I feel like I'm helping my community.
Right, exactly. And you can help. You can, I'm a business coach. That's what I do, right? I help people navigate through their business. Jevon,
and there's no charge, because yes, you can call up directly and enroll with the plan over the phone. But you want to know what the problem with that is? You don't have anybody to hold accountable for that. Because if you call and you give your doctor list and they mess up, then you're going to be locked out, so they don't really have that same kind of, loyalty to you that someone like I do, because you can find me.
Right. and I like what you said about, if you have reservations about changing your employer health plan, and one of those reservations is you've been with your doctor for such a long time, or the network, or you're having problems with the network, they can call you and you have some insight information as to, after you have that conversation with them, it's like, okay, Jane, can you help me with this? I don't know where I'm supposed to go, but I know I'm not getting what I need here. Do I have to wait because I did that with my uncle. I thought we had to wait until October to December to make that change. I had him ready
for
to
a doctor,
make.
You mean?
To change in the network or change the network.
Oh no, you can do that as long as you call before the 15th of the month. You can change it every month.
Oh, see, we were waiting to December. I had him ready to make the change, and I was under the impression we had to wait till October to open enrollment. But that's
only the plan.
That's only the plan. Okay. Yeah. All right. Yeah. Because I couldn't get him. I had him.
Is he Medi-Cal too? Is he Medi-Cal too?
Well, he passed away, but
okay.
When he was first diagnosed, and I was trying, and my aunt called me and said, can you help him? Because here's the other thing that I found both with my mom and my uncle. When you get to a certain age, 68, 70, when they go to doctors, they're no longer listening to them.
Yeah.
They're not hearing anything that they have to say. So you really truly need an advocate. And I really,
Right.
I tell everyone, get an advocate for when you
Right.
go
Oh
in.
yeah.
You got to have somebody to fight for you. And
Mm-hmm.
because they just stop listening. You come in and you're like, well, this hurts or that hurts, and they're like, you're old. You know,
Yeah.
it hurts everybody.
Yeah.
And then you find out that it's something devastating. I remember with my uncle, I couldn't find him. I was calling and I couldn't get to him, and I went over to his apartment. It's like, what the heck happened to him? He had gone to he had a little bladder infection, which is detrimental when you get to a certain age.
Yeah.
He went to the hospital. He had prior to that, he had been diagnosed with prostate cancer. They had the surgery, and what had happened, it was a month or two after, he flew to see a cousin of mine, got dehydrated on the plane, wasn't drinking a lot of water beforehand, all that kind of stuff. So when he got back home, he was feeling discomfort. The medical center that he went to was right like 4 blocks from him. So he went there, and they admitted him. They didn't call me. I was the emergency contact. I had to literally hunt him down in the city in order to find him. And when I found him, he was at the worst hospital in the network, I believe. And they were getting ready to schedule him for surgery. And I'm like, have you called his doctors? He has a whole slew of doctors.
Yeah.
No, his PSAs are up here, and we got to go. We have them scheduled for 7:00. No, you do not.
Exactly. Yeah. You got to, yeah.
I had to fight and get him. And when I called scan, it's the scan, and then there's the provider, the one that you actually get to talk to. And the lady's like, take him out of that hospital right now.
Right.
And then, I'm like, okay, the insurance company is telling me, let me take him out of the hospital. But he was telling him, I already had this surgery. They had already done, his urology had already done the surgery. They were getting ready to take him back in again. Here, a 80-year-old man, he had already went through this. And so I had to just, and by the time I got done, I turned the hospital upside down. When I came in, whenever I would get off the elevator, the nurse is like, here she come, here she come, here she come.
You know what? It's really scary because, like you said, they do need an advocate. And there's a lot of older people that do not have family, and they literally take advantage of them. They literally just take advantage of them, especially when they know there's no family, they take advantage. They literally do. It's really scary when you get older and you have no one around to help.
Oh, it is so.
I see that all the time.
Yeah, I bet you do. I was like, and if you're not you got to become a barracuda. You can't be nice. And so when I got there, it's been a long time since I've gone to visit somebody and there's 4 people in a room. They had put him in, and this is like 3 years ago. 4 people in a hospital room. Like, when did this wait? Usually 2, right? And then there was one guy, they had just been holding him there like he was hostage, and they were just building his Medicare. And after I showed out with my uncle and got him transferred out, the doctor was mad. I don't care if you mad, dude. It's my uncle. And when I came to get my uncle, there was another guy, he goes, they're letting me go home too. What did you must have told 3 people in that room.
You know what, Crystal? They have it's so much corruption. They have senior facilities that literally where people have no family, and believe me, the owner of that senior facility sometimes has something going on with the doctors. Do you know what I mean? They put them all on a bus and take them to the doctor for the day. It's really scary. And I've even had it where people will call me and say, I got disenrolled. I disenrolled from my plan because the person that owns the facility gave me the phone and told me to tell my plan I don't want the plan, only because they could not get their money. Oh, there's a lot that goes on,
my
but that's a
goodness.
whole nother conversation. But if you don't have family there that's watching you, and there's a lot of people that take advantage of seniors, and we have to take a test every year just to be senior certified, and it's a 50 question test, and you have to pass it by 90%.
Wow.
Because people prey on seniors.
Yes, they do.
So it's really,
they do.
It's such a travesty, but I think
crazy.
even if they're not preying on you, if you don't understand what's going on, it can feel like it can feel and look like they're
right
preying on you because you don't have an understanding as to what's going on. And so, to your point about the advocate, that's definitely important. And my mom had cancer before she passed away. She passed away of breast cancer. One of the facilities that we went to actually provided her an advocate. They were paid by the hospital to advocate for her. And just the lady just came out and said, "I'm on your side. The hospital wants me to be here to make sure you get the best care possible." And I thought that was really cool because I had no clue what to ask for, you know. And I think I'm a pretty bright person.
Right, but until you're in the play, that's why, Jane, you are valuable. And I have a lot of friends. Obviously, that are in that position where we're caregiving for our parents, and some of them are just lost. I mean, some of them are very astute at what they do, but I have one girlfriend, she researches everything, but others, it's like, well, the doctor said no, we need somebody outside of the doctor to tell us what we need to do. But it's so overwhelming to take care of your elderly parent when they get to this place. And even when they're making decisions, Jevon, for you for retirement, because they just want to get out, right? They're just like, okay, but having their kids involved, I think is really important. Jevon and I talk about this all the time, that your retirement, your getting older is a family affair, not not an individual affair.
It's so
it's scary. It's really just watching. I mean, I see so much, and it's really, really scary.
Well, it's so interesting that it is so scary, and it just doesn't have to be that way in so many situations if they just talk to you, if they call you up on the phone and ask you a few questions and get things worked out. I think you just provide an invaluable service. We definitely need to get that number and get you access, or allow people to call us and get to you or something like that, because
I think so. And
we're all getting old.
I think we're going to have her come back and talk about long-term care, because that's a big one right there. Because I would think that would be right along in that 5-year marker when you're talking about retirement. When they should be applying and getting their long-term care and paying into it while they're working.
Actually, they should be getting it much earlier, because by the time you hit 60,
you got it. You should be getting it before. You should be getting it before 40. Ideally, you should be getting it in your 20s or your 30s when it's cheaper, and you can get an unlimited policy. But at that age, we all think we're invincible. We're never going to die. We're not even thinking about that at that age. And that's a whole nother conversation.
Yeah, we're going to have you come back and talk about that one. But I do know that, these conversations that we are having on the patio, and just having in general, especially after our last year with COVID, our health is not always something that we can plan. Things can happen outside of our planning stage and really highly affect your life. Because even if you got COVID and you find out down the line that you're one of the long haulers, then you have some other chronic illnesses, and you got to have your health insurance. And from what is my understanding, these are things that they may not all appear soon as you're back up on your feet. They may, be a delayed kind of appearance for them. But if you don't have the appropriate health care or understand your health care, your Medicare, your Medi-Cal, whatever it is, your med supplement, then you're dealing with an illness and the bureaucracy of the insurance that you have or don't have.
You know what, Crystal? With Cover California, I have people that will, you can get different tiers like a bronze, silver, gold, and platinum. And the bronze has a really high deductible. I cannot tell you how I have people that call me, oh, I'm 55, I'm 60. Just give me the bronze plan. It's really cheap. I know the deductible is high. I've never been sick in my life. I'm a very healthy person. And then I want to say, okay, if you've never been sick in your life, I'm going to tell you right now, 60 things start getting really weird. Mm-hmm. And there's some little things may show up that you didn't notice before. But if you've never been sick, that may be a time where something, you know what I mean? Don't because you've never been sick, but mm-hmm. things start to get really funny between your mid 50s and 60 and 65. And so I had a guy that told me, oh, I've never been in the hospital. I've never been sick. And I said, okay, this is a high deductible. So I'm telling you, if you get sick, you're going to be coming out. You're going to pay a lot of copays. Yeah. Why did this man call me from the hospital 6 months later? Why do I have all these copays? And I said, remember we had that conversation? And I tried to tell you not to get the bronze, but you were telling me that you were very healthy. So even though you've always been healthy all your life, sometimes when you get up in age, little things start happening.
That's a very good point. Very good point.
It is that, they do. Little things start to happen.
Mm-hmm. That's true, because your body is changing and aging, and if you're, we might get lax on some of the things that we use to keep for flexibility going, and of course high blood pressure and diabetes. All those things. It takes
longer for your bones to heal.
Mm-hmm.
It takes longer for your bones to heal. I twisted my ankle. It took forever. Because we don't slow down sometimes, and we think that when we're 50 and 60 that we could still do what we did at 40 and 45. And then eventually you find out, oh no, you know what? I can't move like that anymore. I can't, even though my mind is telling me I can do this,
The mind says so.
Yeah, your mind is saying I can do this, right? And then your body later goes, ooh, okay.
Right.
That's not
I can't do that. Right?
So true.
Right. My sister and I were in the garden yesterday, and we had to unload our soil, and we were like, how come this bag feels heavier than it did the last time we went to buy soil?
Right.
And we have it on a little moving cart, and she's like, this seems so heavy. I think I need to stop and go take a Tylenol.
Okay, let me tell you something really funny. I had a friend that bought a house, and she had a full basketball court, right? And then she had a barbecue, and it was a lot of couples there. And all the guys got up and they wanted to show off with their wives and their girlfriends, right? And these guys were 40 and 50 years old. My brother-in-law ended up hurting himself. He was growing. We couldn't even eat. We had to leave and take him to the emergency room. Another guy twisted his ankle. Another guy hurt his back. It was so funny. And it's like, you guys, you can't do this anymore, especially if you haven't been exercising and you're not in shape. Like, even though your mind is saying, oh yeah, I want to get out there. And the wise guys just said, I'm not good enough. They're
right, crazy. Exactly. Yeah, as you get older.
And I'm telling you, they started dropping like flies. They started dropping like flies.
But their ego is telling them something else, and their body's like, let me show you who's boss here, dude.
Indeed.
Right.
Indeed.
Yeah. It's so funny.
Yeah, I hate to jump into this because this is an amazing conversation, but we are at our point. Jane, I hope you will consider coming back and spending some time with us and talking about long-term care and more Medicare stuff. And I just want to say thank you so much for hanging out.
Thank you for having me.
Oh, this is awesome. We learned so much. We'll make sure you get the when Jevon gets it loaded up to a YouTube channel, we will make sure you get the link and you can put it on your website or however you want to use it, and it'll be on our sites as well. But this has been awesome. Thank you so much. Another great conversation on the patio.
Indeed. And with that, Chris, I'll let you have the last word. Oh, go ahead, Jane.
I just wanted to, did you have a contact information or anything if anybody wanted to reach you? Your email address or go to your website?
So my phone number, 626-372-9097. And then my website is coveredcaliforniamedicare.com.
Covered California.
And everything on my website.
Okay.
Jane, I don't know if you can see this, but we did get a comment from Wanda Johnson. She says, good info. Jane, you're on it with LTC. So people are paying attention. They're getting the word. You're preaching, and we love it. That is awesome. Okay. Thank you so much.
Thank you.
I just wanted to get the Covered California. That's California spelled out or just CA?
It's Covered California spelled out.
Okay. And that was .org?
.com.
.com. Okay. Yeah.
Covered
we
California,
will make sure
Medicare.com.
And Medicare, Covered California.
Medicare.com.
Medicare.com. Yeah. Okay. We will make sure that we get that up, I'll put that on the links of my pages. But awesome information.
Awesome.
Thank you.
Thank you, Jane.
So thank you. Bye. You guys have a good day.
Bye. You too.
Bye.